Imagine waking up in the morning and hesitating to get out of bed, not because you're tired, but because every movement sends a wave of discomfort through your knees, hips, or back. For millions of seniors around the world, joint pain has quietly become a part of daily life, slowly stealing away their freedom one step at a time. The stairs seem steeper, the walks shorter, and the evenings longer as pain limits even the smallest joys. Gardening, playing with grandchildren, or simply standing in the kitchen to cook a favorite meal. But what if there was another way? What if age didn't have to mean agony? What if pain wasn't the price of growing older? After 60, our bodies naturally go through changes. Cartilage, the smooth cushion between our joints, begins to wear down. Synovial fluid, which keeps joints lubricated, reduces in volume. Bones may start to thin, and muscles that once supported our joints may weaken. It's true that these changes make joint pain more likely, but they do not make it inevitable. The key lies in understanding your body, listening to its needs and responding with care and consistency. Take the story of Anthony, a 72-year-old man from Melbourne. Once a vibrant tennis player, he gave up the sport when his knees began to ache after matches. For years he believed it was just part of aging. But when the pain became so severe that he needed help getting out of chairs, he knew he had to act. Instead of relying solely on medication, Anthony consulted with a physiotherapist and a nutritionist. Together, they developed a plan that included gentle resistance training, a diet rich in anti-inflammatory foods and daily movement. 6 months later, Anthony wasn't just walking without pain. He was back on the court, carefully and joyfully swinging his racket. Modern science supports stories like Anthony's. Numerous studies have shown that specific lifestyle changes can significantly reduce joint pain and even improve joint function. For example, a clinical study published in Arthritis and Rheumatology found that older adults who practiced low-impact exercises like Tai Chi experienced a remarkable reduction in knee pain. Another study from the University of Pittsburgh revealed that seniors who engaged in strength training just twice a week reported up to a 43% improvement in joint flexibility and overall pain relief. Movement is, in fact, one of the most powerful and underused tools against joint pain. While it may seem counterintuitive to move more when you're in pain, gentle, regular motion helps keep joints lubricated, strengthens the surrounding muscles, and prevents stiffness. Walking, swimming, cycling on a stationary bike, or participating in chair yoga can all make a noticeable difference. Even 10 minutes of daily movement can begin to break the cycle of pain and immobility. But exercise alone is only part of the equation. Nutrition plays an equally vital role. Inflammation is a silent trigger behind most joint pain, and the foods we eat can either fuel that fire or help calm it. Diets high in refined sugars, saturated fats, and processed foods have been linked to increased joint discomfort, especially in those already dealing with osteoarthritis or rheumatoid conditions. On the other hand, research from the National Institutes of Health shows that a Mediterranean-style diet, rich in olive oil, fatty fish like salmon, leafy greens, berries, and nuts, can significantly reduce systemic inflammation and support long-term joint health. Let's look at Maria, a 68-year-old retired nurse in Florence. She lived with chronic joint pain in her hands and shoulders, making it difficult to cook, sew, or even open jars. Her doctor suggested adding omega-3 fatty acids and turmeric to her diet. With small changes, swapping out red meat for grilled fish, drinking golden milk with turmeric and adding more vegetables to her plate, Maria noticed her pain subsiding within weeks. Now she enjoys her hobbies again, her grip has improved, and she feels more confident and in control of her life. Another overlooked factor in joint health is weight management. Excess weight, even as little as 10 pounds, can put tremendous pressure on the joints, especially the knees, hips, and lower back. According to the Arthritis Foundation, every pound of extra weight adds about 4 pounds of pressure on the knees. Losing just 5 to 10% of body weight has been shown to dramatically reduce joint pain and improve mobility in older adults. And then there's sleep. Poor sleep doesn't just affect your mood, it worsens your perception of pain. Studies from Johns Hopkins Medicine have shown that chronic sleep deprivation heightens inflammation and increases pain sensitivity. Establishing a calming bedtime routine, limiting screen time before bed, and addressing underlying sleep disorders like sleep apnea can help the body rest and repair overnight, when most tissue healing takes place. Beyond the physical aspects, joint pain takes an emotional toll. It can lead to isolation, depression, and a sense of helplessness. That's why support, whether it comes from family, friends, or community groups, is so important. Sharing your struggles, joining walking clubs, or participating in group physical therapy can provide motivation, accountability, and much-needed encouragement. No one should feel like they have to fight pain alone. In a world that often accepts joint pain as an unavoidable part of aging, it's time to challenge that belief. Aging does bring changes, but it can also bring wisdom, strength, and new strategies for living better. With the right tools, movement, nutrition, rest, and support, joint pain can be managed, minimized, and in many cases reversed. Your body, even at 60 or 70 or 80, is still capable of healing and thriving. The journey to pain relief doesn't require perfection, just patience, persistence, and the belief that a more comfortable, active life is possible. Understanding joint pain after 60 is crucial because it helps break the misconception that pain is just something one must accept as part of aging. In reality, joint pain is often a signal from the body indicating wear and tear, inflammation, or underlying conditions like arthritis. Knowing how to respond effectively can change the entire experience, turning frustration into hope and helplessness into action. Many seniors don't realize that their lifestyle choices, daily habits, and even emotional health directly influence the intensity and frequency of joint pain. This awareness opens the door to meaningful change. One important aspect is the role of inflammation in joint discomfort. Chronic inflammation often worsens joint pain, and it can be fueled by factors like poor diet, stress, and lack of movement. However, the good news is that inflammation can be managed through targeted approaches. Diet, in particular, stands out as a powerful tool. Foods rich in antioxidants and omega-3 fatty acids help reduce inflammation and promote joint health. Fatty fish such as salmon and mackerel, colorful vegetables like spinach and kale, and nuts such as walnuts are excellent examples. Incorporating these into daily meals can gradually ease the burden on joints. Beyond nutrition, proper hydration is essential. Water not only nourishes the body, but also keeps the joints lubricated. As we age, the amount of synovial fluid in joints decreases, making movement stiffer and more painful. Drinking sufficient water throughout the day helps maintain joint fluidity, cushioning bones and preventing friction. Many seniors overlook hydration, often because the sensation of thirst diminishes with age. But keeping a water bottle handy and setting reminders can make a big difference. Another key factor is the importance of tailored exercise. While strenuous, activity may be out of the question for many older adults. Gentle and consistent movement strengthens muscles around joints, improves flexibility, and reduces stiffness. Exercises such as swimming, water aerobics, tai chi, or low-impact yoga are excellent choices. These activities provide cardiovascular benefits while being gentle on sore joints. They help maintain range of motion and build muscle support, which lessens the stress on joints during everyday activities. Weight management also plays a significant role. Extra pounds increase pressure on weight-bearing joints, especially the knees and hips, accelerating cartilage breakdown. Shedding even a modest amount of weight can ease joint stress and improve mobility. For seniors, losing weight can be a challenge due to slower metabolism and muscle loss, but combining balanced nutrition with appropriate exercise often leads to sustainable results. Rest and sleep quality cannot be overlooked either. During sleep, the body repairs tissues and regulates inflammation. Poor sleep can heighten pain sensitivity, creating a vicious cycle of discomfort and sleeplessness. Establishing a relaxing bedtime routine, reducing caffeine intake in the evening, and creating a comfortable sleeping environment are simple yet effective strategies to improve rest. Mental and emotional well-being also impact joint pain. Stress and anxiety increase muscle tension and inflammation, which can worsen pain perception. Mindfulness practices, meditation, or even hobbies that bring joy and relaxation can reduce stress levels, indirectly benefiting joint health. Finally, regular consultations with healthcare professionals ensure that joint pain is properly diagnosed and managed. Physical therapists can design personalized exercise plans, while doctors can recommend medications or supplements that might aid in symptom relief. Some seniors find relief with therapies such as acupuncture or massage, which help increase blood flow and reduce muscle tightness around painful joints. The journey to managing joint pain after 60 involves multiple dimensions: diet, hydration, movement, rest, and mental health. When these pieces come together, they form a holistic approach that empowers seniors to regain control of their mobility and comfort. The body's capacity to heal and adapt remains strong well into the golden years. It just needs the right support and care. When joint pain becomes a daily companion, it can feel overwhelming and discouraging, especially for seniors who long to live independently and enjoy life to the fullest. But there is hope. Effective solutions exist that can help reduce discomfort, improve mobility, and restore quality of life. The key lies in combining medical insights with lifestyle changes tailored to the unique needs of those over 60. By embracing these methods, seniors can reclaim their strength and confidence. One of the most powerful tools against joint pain is physical therapy. Many seniors hesitate to seek help, thinking that pain is simply something to endure. But professional guidance can make all the difference. Physical therapists specialize in assessing the specific joints and muscles causing pain, then developing personalized exercise routines that strengthen muscles, improve flexibility, and promote healing. Unlike general exercise, these targeted routines are safe, effective, and designed to minimize strain. For instance, strengthening the muscles around the knee can relieve pressure on the joint itself, decreasing pain and enhancing stability. This tailored approach not only reduces discomfort, but also helps prevent falls and injuries, which become more common with age. Alongside physical therapy, incorporating gentle daily movement is essential. Activities like walking, swimming, or chair yoga help keep joints lubricated and maintain range of motion. It's important to start slowly and listen to the body's signals, increasing activity as comfort allows. Even small amounts of movement stimulate blood flow and reduce stiffness, which can make a significant difference over time. Seniors often find that consistency, rather than intensity, is the key to lasting relief. Nutrition also plays a vital role in managing joint pain. Foods rich in antioxidants and anti-inflammatory properties help reduce swelling and support tissue repair. Omega-3 fatty acids found in fatty fish such as salmon and mackerel have been shown in numerous studies to decrease joint inflammation and improve symptoms in arthritis patients. Incorporating colorful fruits and vegetables, whole grains, nuts, and seeds into meals provides essential vitamins and minerals that support joint health. Conversely, it's wise to limit processed foods, sugars, and excess salt, as these can aggravate inflammation and worsen pain. Hydration is equally important. Drinking enough water helps maintain the synovial fluid that cushions joints, reducing friction and discomfort. Sometimes joint pain requires medical intervention beyond lifestyle adjustments. Medications prescribed by doctors, such as non-steroidal anti-inflammatory drugs, NSAIDs, can help control pain and inflammation. It's important, however, to use these under professional supervision due to potential side effects, especially in seniors. For some, supplements like glucosamine and chondroitin sulfate have provided relief, though it's best to discuss these options with a healthcare provider to ensure safety and effectiveness. Mind-body therapies can also offer substantial benefits. Practices like meditation, deep breathing, and guided imagery help reduce stress, which often exacerbates pain. Chronic pain can take a toll on mental health, leading to feelings of isolation or depression. Joining support groups or engaging in social activities can uplift spirits and provide encouragement. Emotional well-being is deeply connected to physical health. Nurturing both creates a positive cycle of healing. Lastly, don't underestimate the power of proper rest and sleep. Quality sleep allows the body to repair damaged tissues and regulate inflammation. Seniors struggling with joint pain should establish soothing bedtime routines and create a sleep-friendly environment. Sometimes consulting a sleep specialist or addressing conditions like sleep apnea can further enhance recovery and pain management. If you or a loved one is struggling with joint pain after 60, remember that you are not alone and relief is within reach. Implementing these evidence-based solutions can transform daily life from one of limitation to one filled with renewed freedom and joy. For more helpful health tips and trustworthy guidance on senior wellness, please consider subscribing to Elderly Health Path. Together we can navigate the path to better health and well-being.